Ma'am, nabanggit po ninyo yung well, the many variables that you will have to consider for anybody to make a recommendation for a lockdown. If you don't mind po, what would be the trigger numbers? For example, for hospital occupancy or utilization rates, what could be the trigger number or the trigger level? And the same goes for the R naught and the positivity rate.
Yes, sir.
What would trigger po?
Yes. Dati, ang atin pong triggers talaga for us to escalate would be our healthcare system. Yung atin pong tinatawag na healthcare utilization plus the ICU utilization. Dati, nung wala pa ho itong mga variants of concern, ang means of doing that would be to look at HCUR. Pag napunta ka na sa high risk, kailangan isara kita. Pero ngayon, because we know that Delta variant is highly transmissible, pag umabot pa lang ho tayo doon sa moderate risk at doon sa border going to high risk, kailangan tinataas na ho natin yung signals natin, kailangan na po natin magsara. Ang sa atin lang po, we are currently on GCQ with heightened restrictions. Our local government here in National Capital Region ay nag-impose ng curfew. Meron pang ibang mga restrictions doing active case finding and all. So parang ang sa amin, we are trying to analyze it well kung kailangan natin mag-escalate. Kaya po hindi kami nagsasabi na kailangan isara na agad ngayon. Kailangan meron ho kaming ebidensya talaga. At kailangan makita rin natin, syempre, laging sinasabi, health lang ang sabihin mo, pero hindi po pwede yun eh. Kasi whatever economic impact na magkakaroon because of these lockdowns, kasama pa rin po ang health. Because meron ho yung epekto sa kalusugan ng mga kababayan natin. Kaya laging balanse ang desisyon natin.
Ma'am, would it be fair to say that at this particular point, there is no indication yet that we have any need to escalate?
There are indications, yes sir. That is a fact also. Nakikita na nga po natin na nag-increase na yung mga number of cities na binabantayan. Nakita na rin po natin na tumataas ang mga kaso. And based from the local government officials report to us, meron na po silang mga nakikita dun sa kanilang areas na mga barangay na nagkakaroon na ng mga ganitong pagtaas ng kaso. So meron ho na tayo mga indikasyon ngayon. Pero ang katulad nga, babalikan natin, kailangan lahat yan objective ang basis natin. We are not acting out of taste, we're not acting out of fear, we're not acting out of impulse. Kailangan masiguro natin, may basihan. Kasi tandaan nyo, kung ano man ang ididesisyonan natin dito sa National Capital Region based on the details or the basis that we have used, kailangan magamit natin yan sa ibang lugar. So pag inumpisahan po natin sa isang lugar, dapat uniform ang standards at parameters na gagamitin so that we can apply it to the other regions as well.
Okay, but yesterday we were talking to Professor Guido David of the research. Of course, they're a doctor of a different sort. Professor Guido is into numbers and mathematics. Pero from their point of view, there's a need to impose a circuit breaker of the sort na parang last year, yung parang August natin na circuit na lockdown. So that's a bit of a radical proposal. And if you listen to DOH naman kagabi, parang we're not yet there. Your point of view po, are we on the way there? Are we there? Or ano po? What's it look like?
So yun na nga yung problema, di ba? Parang everybody is trying to figure out when is the correct point in time to actually implement a stricter lockdown. Because we all recognize that doing it too early might not be helpful and doing it too late might be too late. So the metrics that we have right now that we're using, such as hospital occupancy, are not yet at that point. Kaya siguro very conservative yung messaging ng DOH. Pero siguro yung isang nire-recognize din natin is that we're talking about a different variant. We're all being reminded that this is more transmissible. So to be fair, tinitignan din naman yung angkulong yon na dapat ba ibahin yung metrics na tinitignan natin? Should we be looking at other parameters like maybe rate of rise rather than just absolute numbers? And all of this will have to be put together because we all know the implications of another community quarantine or a stricter community quarantine.
But how because when we interviewed Professor Guido last night, he made it very clear, really, that the longer we delay, the higher the cases might rise. And if that happens, we could be looking at another March to April scenario, no? I mean, you know, how serious is it really? Because that's what people want to know. And shouldn't we be making assumptions nga, based on the transmissibility of Delta, knowing how slow we are in detecting this particular variant because of our genome sequencing capability?
So let me pick up on that, Luchi, no? Our actions should, our intervention should not depend on whether we identify the next case as a Delta again. Our action should be working on the presumption that because we know that Delta is already locally transmitted, then we have to assume that all cases are Delta. That's the only way we can keep a step ahead. Now, with respect to assumptions, yun na nga yung problema. Ano ba yung assumptions na relevant? This is an unknown quantity. We can pick up a little bit from the experience of other countries, but they're not exactly the Philippines, and we're not them. But what we're trying to do right now is to put in projections like, if we do this at this week, will it have the same impact as if we do it next week? Will there be a big difference? Because keeping the economy open for 1 hour, we can make a difference in livelihoods. But will it make that much of an impact in terms of cases? So it is possible to model stuff like that rather than just have knee-jerk reactions and say, ngayon na, you know. So yun yung actual na, yun yung problema natin that we're trying to resolve using data. But of course, everybody recognizes that the numbers are really concerning. I think we're all on the same page on that. It's just a question of when is the best timing.